Hi, I'm Dr. Sonia Nayyar, and thank you for coming back to our dementia series. Today we're going to talk about the different risk factors that we have for dementia, and I'm really going to break it up into two different parts. One, that's modifiable, which means things that we can change, and then the non-modifiable, things that we cannot change to change our risk about dementia. So the first thing, the non-modifiable. So we really focus on this, unfortunately, is age. We know that as we get older, we have an increased risk of having dementia, and of course that's not something we can change. But same goes with our gender and our ethnicity. As we had talked in the previous series, that being female, being black, or Hispanic have the highest rates of having dementia. But we can talk a little bit about genetics at the standpoint, because of course genetics is something that we can't change, that we have in ourselves. The genetic story with Alzheimer's is quite complex. Unfortunately, it's still something that we don't understand and is still evolving with time. But one thing that we do know is that if you have a first-degree relative, a parent, a sibling with Alzheimer's, your risk of getting dementia is about 10 to 30% increase than the general population. There's even known genes that increase your risk, but it's not very simple. It's not as simple as if you have the gene, you have an increased risk. This gene is known as the APOE, and actually there are some parts of the APOE that actually is a protective factor, which means it decreases your risk of having dementia, but there are certain forms that increase your risk. It's still an evolving, because it's not very black and white in the sense that having it means that you're going to have it, and we still don't understand to what extent it increases your risk, because we obviously believe that there's a lot of other factors that play a part into it. So as of right now, the genome testing is not recommended, but it's just something to be aware of. So let's talk a little bit about modifiable, which really means what can we change. And I love talking about this because these are things that we can do to decrease our risk overall. We had talked previously about controlling our vascular risk factors. Now, what do I mean by vascular risk factors? This is really controlling medical conditions such as high blood pressure, high cholesterol, diabetes, cardiac risk factors, and if you smoke, and obesity. So all of these things, by controlling them, talking to your primary care doctor, seeing your specialist if needed, and taking your medications can decrease your risk over time. 2, sleep. Poor sleep we know has to do with dementia. So if you have obstructive sleep apnea, seeing your sleep specialist, wearing your CPAP can help as well. 2, repetitive head trauma. We know people who get hit in the head multiple times have an increased risk of dementia. So decreasing whatever you can for these non-accidental is important as well. 2, depression and anxiety. The depression and anxiety is really important to address. Unfortunately, there is a huge stigma against depression and anxiety, but what we're starting to learn is that dementia, depression, anxiety really go hand in hand. So if people have poorly controlled or undertreated depression, it can cause a pseudo-dementia, meaning it looks like a dementia where they have memory problems, but by controlling the depression, you can decrease your risk of dementia. But it is a little bit of a vicious cycle. Sometimes having the diagnosis of dementia increases your rate of depression, and then depression worsens the dementia. So really talking to your primary care doctor or psychiatrist or therapist or counselor can help control the dementia and anxiety. Lastly, I want to talk a little bit about protective risk factors. When we talk about risk factors, of course, there are things that increase our risk of having dementia. But what are some things that decrease your risk of having dementia? Now, if you have young children or you're still in school, that higher level of education is really protective. So studies show that people who do higher level of education past 12th grade have decreased rates of dementia. 2, physical activity. People who are out and about do well. So people who are couch potatoes, they don't exercise regularly, they do poorly. So I really encourage my patients, go out, get moving. I'm known to always say you don't have to go out and run a marathon, but even working slowly, starting 5-minute walks daily, working your way up to 10 minutes, 15 minutes, 20 minutes, has a very additive and protective factor for dementia. Lastly, social interaction. people who have a large social group, whether it's through friends, through family, even having the habit of striking up a conversation when you're at the grocery store with strangers or the clerk. These type of things are very helpful for dementia. So these are just a few little informations about the modifiable and non-modifiable risk factors. Join me next time where we'll talk a little bit about signs and symptoms of dementia. Thank you.